Imagine if you possess the ability to shield yourself from one of the most dangerous cancers affecting men today. Prostate cancer is a silent threat that claims thousands of lives each year. Yet, it's a condition that can often be prevented when detected early. Before we go further, if staying ahead of dangerous health threats matters to you, hit subscribe and turn on the bell. This channel brings you life-saving tips you won't hear anywhere else. According to the National Institutes of Health, prostate cancer stands as the most common cancer among men in the United States. It's ranked as the second leading cause of cancer-related deaths in men. The startling reality? 1 in 8 men will be diagnosed with prostate cancer during their lifetime. And in 2024, over 30,000 men lost their lives to this disease. In 2025 alone, more than 100,000 men in the U.S. are expected to receive this diagnosis. However, there's some positive news. Prostate cancer does not need to be a death sentence. If you recognize the early warning signals and respond quickly, you can greatly improve your survival chances. The issue is, most men pay no attention to the prostate gland until it's too late. The prostate gland is a walnut-sized organ found in males, located directly below the bladder and in front of the rectum, wrapping around the urethra, the tube that carries both urine and semen from the body. It produces a fluid that comprises about 30% of semen volume, which helps to nourish and protect sperm cells during ejaculation. The prostate is also vital for muscle contractions during ejaculation, highlighting its essential role in reproduction and fertility. In this video, we'll uncover the 12 early warning signs and symptoms of prostate cancer that are frequently missed. These subtle clues can easily slip by unnoticed, but identifying them could be the difference between life and death. So, if you're over 40 years old or you have a family history of prostate cancer, this video is crucial for you. First, let's discuss what you need to understand about prostate cancer. Despite how common it is, many people remain unaware of the earliest signs, which often leads to delayed diagnoses and more complicated treatments. Sadly, the lack of open conversation about prostate cancer only increases its dangers. When it comes to prostate cancer, did you know that age is the biggest risk factor? The odds of developing prostate cancer rise sharply after the age of 50, and it's most often found in men over 65. Here's the most troubling part. One of the most deceptive features of prostate cancer is that it can progress silently with no obvious symptoms in its earliest phases. However, as it advances, it may produce a range of symptoms from urinary changes to pain in the pelvic region. Understanding these symptoms and knowing the importance of routine screenings can drastically raise your chances of catching the disease early and getting effective treatment. Now, let's look at the 12 early warning signs and symptoms that can help you identify prostate cancer even before undergoing a medical exam. After we review these 12 symptoms, we'll also explain the typical causes of prostate cancer so you can lower your risk of getting it. Don't skip that section. Sign number 12, blood in urine. Have you ever noticed blood in your urine while urinating? This concerning sign, called hematuria, is one possible warning of prostate cancer. It might look like pink, red, or brown coloring in the urine, and sometimes it's only detected by microscope. The presence of blood usually signals more advanced prostate cancer, making it extremely important to seek medical advice immediately. While other problems like urinary tract infections or kidney stones can also cause hematuria, it's crucial not to ignore the symptom. Early discovery and treatment can improve outcomes. So keep a close watch and be proactive about any changes in your urination habits. Number 11, difficulty urinating. Do you struggle to urinate? This warning can appear in several ways. You could find it hard to begin urinating experience a weak or stopping stream, or feel like your bladder isn't completely empty, even after going. Here's why this happens. Prostate cancer can put pressure on the urethra, making it more difficult for urine to flow smoothly. Type 1 if you're still with me, and hit the like button if this information could help save lives. Number 10, inability to urinate while standing. Imagine this scenario. You go to use the restroom, but suddenly you find it difficult or impossible to urinate while standing. This uncommon change can be disturbing and inconvenient, pointing to a more serious, hidden issue. When prostate cancer affects the prostate, it causes a gland to enlarge. This larger prostate may push against the urethra, blocking the urine flow. As a result, some men have trouble urinating while standing and may choose to sit instead. Number 9, a pronounced burning sensation while urinating or during ejaculation. Do you experience a burning feeling while urinating or when ejaculating? This unpleasant symptom, which can vary from mild to severe pain, may mean that the cancerous tumor in the prostate is irritating or compressing the urethra and nearby tissues. Here's something important. This burning sensation isn't just uncomfortable, it may also signal inflammation inside the prostate. Although other issues, such as urinary tract infections or prostatitis, may cause similar discomfort, you shouldn't ignore the possibility of prostate cancer. Ongoing burning, when urinating or ejaculating, requires prompt medical attention. Number 8, frequent urination, especially at night. Do you often notice yourself waking up throughout the night to use the restroom, leaving you drained and restless? Frequent urination at night, called nocturia, can interrupt sleep and contribute to ongoing fatigue. While it's common for nighttime bathroom visits to rise with age, a sudden or clear increase shouldn't be overlooked. Since prostate cancer causes the prostate gland to become enlarged, it can press against the bladder and urethra. This added pressure can result in a stronger urge to urinate more frequently, especially at night. You may find yourself waking multiple times, disturbing your sleep and feeling more exhausted during the day. But before moving on, if you're appreciating this video and want to stay up to date on key health topics, be sure to hit the like button and subscribe to our channel. Your well-being is important. Number 7, unexplained weight loss. Were you aware that unexplained weight loss may be a subtle but worrisome indicator of prostate cancer? This symptom is often missed because it can relate to other factors such as stress or dietary changes. However, if weight loss occurs without any deliberate changes to your diet or activity level, it's essential to take notice. Prostate cancer can bring about unexplained weight loss, particularly in later stages when the cancer has spread elsewhere in the body. This happens as the body's increased energy needs and the cancer's impact on metabolism can cause noticeable weight loss. Number 6, pain in the bones. Another important sign to keep in mind is pain in the bones. Often, this discomfort is persistent and not associated with any clear injury. Here's why this matters. As prostate cancer advances, it can move to bones, resulting in significant pain. This type of discomfort is usually noticed in the spine, hips, or ribs, and may vary from a dull ache to sharp, stabbing pain. Interestingly, bone pain linked to prostate cancer doesn't resolve on its own and may be a clue that the cancer is at a more advanced stage. Number 5, fatigue. Do you constantly feel drained, even on days when you haven't done much? This could signal prostate cancer. The fatigue might develop slowly or hit suddenly with full intensity. Fatigue in prostate cancer is more than just regular sleepiness. It's a persistent tiredness that doesn't go away with rest. Here's what's most troubling. Cancer-related fatigue is usually far more intense than normal tiredness after a busy day. It happens due to the body's response to cancer itself, the energy needs of tumor growth, and sometimes as a side effect of treatment. Number 4, blood in semen. Imagine the shock and concern of seeing blood in your semen. This worrying situation can leave anyone feeling exposed and uneasy. Called hematospermia, blood in semen can be linked to prostate cancer as the cancerous. Growth inside the prostate disrupts delicate tissues and small blood vessels. This disturbance can cause blood to leak into the semen, leading to a pink, red, or brown discoloration. Hematospermia can also follow prostate cancer treatments, such as radiation therapy or surgery. However, if you observe the symptom often, reach out to your healthcare provider for complete evaluation. Number 3, weakness, numbness, or tingling in the legs or feet. Did you realize that prostate cancer can occasionally cause symptoms that appear unrelated to the prostate gland? One such symptom is weakness or numbness in the legs or feet. This can develop if the cancer spreads the spine, putting stress on the nerves that manage movement in the legs. When this happens, men might feel weakness, numbness, or tingling sensations in their lower limbs, making it hard to walk or maintain balance. In some instances, this can be so serious that it causes paralysis or loss of bladder and bowel function. Number 2, pain or discomfort in the pelvic region, lower back, or upper thighs. The body is a sophisticated network of connected systems where issues in one spot may impact the entire body. With prostate cancer, pain or discomfort in the pelvic region, lower back, or upper thighs shows how interconnected the body really is. As prostate cancer spreads, it not only affects areas close by, but can also reach the bones and lymph nodes. This spread causes swelling and inflammation, placing pressure on delicate nerves. As a result, pain can radiate from the pelvis to the lower back and upper thighs. Number 1, erectile dysfunction. Are you experiencing difficulty keeping a firm erection? Erectile dysfunction, also known as impotence, is the inability to get or maintain an erection solid enough for satisfying intercourse. While multiple factors can cause this issue, it may also indicate prostate cancer, especially when it appears for no obvious reason. Here's something important. Treatments for prostate cancer, including surgery, radiation therapy, and hormone therapy, can harm the nerves and blood vessels responsible for erections. This damage may result in erectile dysfunction, even if the cancer isn't the direct cause. Are these symptoms opening your eyes? Type 1 if this is helpful, or 0 if you prefer a breakdown on prevention strategies. Next, your comment helps shape future content made for you. So, what about the reasons behind prostate cancer? Learning about them can greatly boost your chances of preventing this condition. Let's explore further. What causes prostate cancer? Prostate cancer is a complicated condition with various contributing factors. Essentially, it happens when changes take place in the DNA of normal prostate cells. These changes can arise during a person's life or be passed down from their parents. Here's a notable fact. Inherited gene mutations account for up to 10% of prostate cancer cases. Genes like BRCA1 and BRCA2, often tied to breast and ovarian cancers, also raise the risk for prostate cancer. Meanwhile, acquired mutations develop by chance as cells divide and replicate their DNA. These errors can lead to uncontrollable cell growth, eventually forming a tumor. Think of your DNA as a guide for your cells. When mistakes appear in these instructions, cells may grow uncontrollably, resulting in cancer. But there's more to it. Other unexpected factors can heighten your risk for prostate cancer. Let's take a closer look. First, obesity and diet are important considerations. Men who eat a diet high in fat, especially one heavy in red meat and full-fat dairy, may have a greater risk. On the other hand, eating lots of fruits and vegetables could help lower the risk. Environmental exposures and lifestyle choices, such as smoking and drinking alcohol, also play a part in developing prostate cancer. Race and ethnicity matter too. African American men are at a higher risk compared to men of other backgrounds. Plus, men with a family history of prostate cancer have increased risk. If your father or brother has had prostate cancer, your own risk more than doubles. However, simply knowing the causes and risk factors for prostate cancer isn't enough to guarantee safety from this disease. Let's discover the best strategies for preventing prostate cancer. How to prevent prostate cancer. While there's no absolute method to completely protect yourself from prostate cancer, several lifestyle habits and health choices can greatly cut your risk of developing this disease. Choose a healthy diet. Since you are what you eat, it's wise to follow a balanced diet filled with fruits, vegetables, whole grains, and lean proteins to support prostate health. Here's a useful tip. Adding foods rich in lycopene like tomatoes and omega-3 fatty acids from fatty fish may provide extra protection. Keep a healthy weight. Did you know that maintaining your body mass index BMI within a normal range can decrease your prostate cancer risk? Losing excess weight and avoiding obesity can further improve your odds prevention. Stay active. Living a sedentary lifestyle increases the risk for many illnesses, including prostate cancer. That's why staying physically active is so crucial. Aim to add regular exercise to your weekly routine. Try to get at least 150 minutes of moderate aerobic activity each week. To help reduce your risk, schedule routine checkups. As noted before, one of the best benefits of taking charge of your health is the reassurance that comes from early detection and treatment. Speak with your doctor to determine the best age to begin annual prostate screenings based on your unique risk factors. Remember, early detection is key for effective prostate cancer treatment and for maintaining a good quality of life. Don't dismiss the signs described in this video. Pay close attention to your body so you can respond quickly if anything seems unusual. Be sure to arrange regular checkups with your healthcare provider. Keep up healthy habits and stay aware of prostate cancer symptoms and risk. If this information was helpful, please like, subscribe, and share this video with your friends and family to help spread awareness about prostate cancer. Now, here's a thought-provoking question for you. What steps are you taking to stay on top of your health? Comment below and let's start a conversation.